And now the details in the news. Minister of Health and Social Development, the Honorable Ronnie Skelton, has welcomed the achievement of universal health coverage for the Virgin Islands, which he says upholds the 1948 World Health Organization Constitution and other international instruments that declare health a fundamental human right. The minister said many useful suggestions were shared publicly and privately by members of the insurance and healthcare industries and residents from all walks of life, all of whom share the goal of a health system that will operate in the best interest of the entire population. Skelton says after consideration of public concerns and widespread misinformation, the decision was taken not to establish a medical review committee. NHI pre-authorizations for overseas transfers will now be managed by an in-house medical director in consultation with the patient's referring physician and overseas specialists. The Chief Medical Officer, Dr. Irod Potter, will perform the duties of NHI Medical Director while recruitment continues for a full-time Medical Director. The Health Minister further acknowledged that legitimate concerns were raised regarding the medium to long-term solvency of the NHI fund. However, he has assured residents that a new actuarial study has been completed and its projections are consistent with the NHI financial model report prepared in 2012. Skelton says both reports showed the fund to be sustainable, providing that its inherent risks are managed skillfully. He says he will seek authorization from the Cabinet soon to table these reports in the House of Assembly. According to Skelton, various risk management mechanisms are built in the NHI design, including reinsurance to protect against catastrophic claims over $250,000. He also explained that after evaluating 3 tenders, an agreement has been reached with Caribbean Insurers Health Limited to provide reinsurance coverage in affiliation with international partners with effect from January 1, 2016. The Health Minister expressed gratitude to local insurance agencies for participating in the tender process and for accommodating the needs of residents who wish to purchase supplemental health insurance policies. Supplemental policies may be used to defray out-of-pocket expenses on co-payments and additional billing when annual limits have been exceeded or in cases where the fees charged by private healthcare providers exceed NHI rates. 22 local healthcare providers have signed participating partner agreements and are now a part of the NHI network. Over 25,000 residents of all ages have registered with NHI since the process began September 1, 2015, and that number is said to be climbing steadily.